Hello friends, I am Dipti. Welcome to my channel's Binayak Physio Healthcare. Today I am going to discuss a new topic, that is fungal infection of the bone, and its contents are the introduction, history, incidence, causative organisms, pathophysiology, clinical features, diagnosis, treatment, and medical management and physiotherapy management. So first we are discuss about the introduction of the fungal infection of the bones. We are discuss here how the fungus are infected or infection of our bones. So introduction. Fungal infection of the bone occurs usually in the patient with suppressed immunological status. So basically, the fungus are infect those people who are immunologically weak. That patients are more prominently affected in the fungal infection. The infection particularly common in a rural population, and the infection result in a tumor-like mass that is called as mycetoma. So basically, when the fungus are infect or the infection of our bones,
and it result it formation a tumor-like mass that is called as a mycetoma.
so it is basically it is more common in the foot, and the other side is that is the lower leg, hands, head, neck, chest, shoulder, and arms. It is mainly occur in the foot, so it is also called as a Modura foot. Modura Foot. Now we are understanding what is Modura Foot. Modura Foot. Modura Foot is a chronic granulomatous infection of the bones and the soft tissue of the foot, resulting in mycetoma formation and gross deformity and discharge a thin pus. And history is it is a first observed in Indian town of Modura, Tamil Nadu, and hence was initially called as a Modura Foot. Basically, the fungal infection of bones, it is basically seen in first time, that is state of Tamil Nadu, and its town name is the Modura, so it is called as a Modura Foot. Incidence are the it is more common in men than in the women, and its ratio is 3:1. And adults are more common than age group are 20 to 50 years. Farmers are more common due to barefoot. Causative organisms. It may caused by fungi or higher bacteria. The causative organisms are basically the Modura foods are caused by the fungus and the bacteria. When the fungus are infect our body, and they form the mycetoma, that is called as a eumycetes. The organisms is called as a eumycetes, and the bacteria is caused by mycetoma. That the organism is called as actinomycetes, and the Modura mycosis is organism names of the fungi which cause, and the Actinomodurae, this is a organism that is a bacteria. is called as a actinomycin, and it is classified about the causative organisms, and it is called as a Mycetoma and the actinomycetoma. Mycetoma is 40% people are affected in mycetoma, and the actinomycetoma and 60% people are affected. And pathophysiology, and we are going pathophysiology. And pathophysiologists typically present in the agriculture workers, which peoples are those peoples are affected which are carrying in contaminated vegetation and burden, or individual who walk barefoot in dry and dusty conditions. Then the causative organisms enters to site of the local trauma. Examples like cut on the hand, foot, splinter, local trauma related to the crying soil and contaminated materials. Then the organisms occurs in the our body, and the organism occurs our body, that is the granulomatous reaction status are started, and any disease usually being as a small subcutaneous swelling over the individual regions, then which then the enlarged, growing the deeper tissue including the bones. And also the lesions track to the surface by a multiple sinuses discharging beside a pseudo-purulent fluid with granules. So this is a pathophysiology of the fungal infection of the bones or a Modura Foot, and then we are going clinical features. Clinical features. The clinical features are the slow spreading skin infection. Basically, when the fungus are infect our body or the infect our foods or other areas, and the infection are directly not affect our body, it is spreading is slowly, and our skin are firstly affect. Then the soda local swellings, and from the small hard painless nodules over the dorsum and sole of the foot. Then the ulcerations occur due to brush of the nodules, and the first discharge the pus or a fluid which the content of a small black granules, so it is called caused by a fungus. Then the multiple discharging the sinuses, and pains occurs usually. The pains occurs any secondary infection, and scarred with the discoloration, and itching of the foot or the infected area. Then we are going to a diagnosis part. Diagnosis, basically first direct microscopy we are done. Here when we observe the discharge pus or the fluid, we are detect the fungus infection when the pus or the fluid are black. If the fluid are white, that is caused by a bacteria. And histological findings. In histological findings, we observe the granulomatous inflammation with abscess formations. Then we are going to a culture. Then we are done culture. In culture, we are done culture due to identify the organisms. when fungus are infected, then fungus are growth in the SDA agar, and it is takes 2 weeks for growth. And the actinomycetes, or by a infection by a bacteria, and it is grow on blood agars. And on X-ray examination, we are show the soft tissue swellings around the foot bones. And we are also show a multiple small like erosions in the bone of the foots. Then we are go and last topic, that is the treatment part. In treatment part, we are discuss about the medical management or physiotherapy management. In medical management, first we discuss in early stage. In early stage, massive doses of penicillin or depsons very effective. And the late stage, when the foot is completely disorganized, and the amputation may be indicated. When the bones are basically more affected, then we are cut the affected or the infection part, that is called amputations, remove the dead part. Then we are discussing last topic, that is the physiotherapy treatment or the management. In physiotherapy management, first we are set a goals or the aims or the objectives. So objectives, first point is to prevent the tightness or contracture of the tendon Achilles. And then we provide the rest, bed rest. Then the maintain of the range of motion of the toes, and the strengthen the muscles group, which is primarily stabilize the pelvis and the hip during ambulations. So then we are going PT or the physiotherapy intervention. In physiotherapy intervention, first we give the foot is splinted in the mid position of dorsiflexion and plantar flexion to prevent tightness of tendon Achilles. We have placed the foot or the splinted the foot in a mid position, because we prevent the tightness of the or the contracture of the tendon Achilles. Next, slow active toe movement are provided. Then the strengthening the hip and the pelvis muscles group with the help of resistance exercise like isometric exercise, isotonic exercise, by using the dumbbell, theraband and weight cup. Then the last, we are training the gait or the ambulation or walking training. By firstly, we are start in non-weight bearing gait training with the help of the crutches walkers. Then we are going slowly in the weight bearing training. Well, this is all about the fungal infection of the bones. And I hope did you like my these topics. And if you have any questions, then please ask in the comment box. And don't forget the like, subscribe, share and press the bell icons. Thank you.